Let's see if Beth is here. It totally worked. Thank goodness.
Good morning.
Morning, lady. How are you?
I'm fine. I get that I'm a little dark over here, but
No, you're not dark. It's also pouring rain and torrential, which is kind of secretly wonderful here in the Bay Area. So I'm kind of happy about it.
Yeah, me too. Me too.
I'm going to go get a nice cup of hot tea after this and just snuggle up.
Tea?
Yeah, because it's, we don't often get this kind of weather and we need it.
Yeah, that tea is warming and nourishing and really good for your chi.
Which we're going to talk about today. Thanks for teeing that up. You're such a nerd. You're such a Chinese medicine nerd.
I am. After 25 years of nerding out.
Okay, so I'm going to do just a little introduction, and then you can correct me on where I might be, missing some things, but I can't wait to introduce everybody to you. Okay, ready? Drum roll, please. My favorite acupuncturist on the face of the planet, Beth Schiffman, who is a licensed Chinese medicine practitioner and a licensed certified acupuncturist. She has her master's in traditional Chinese medicine. Yes. From the, I'm reading it right now, American College of Traditional Chinese Medicine. She is a fellow of the Acupuncture Chinese Medicine Board of Reproductive Medicine, which is how Beth and I met many moons ago. She manages the Northern California, or the NorCal Fertility Group, which specializes in fertility acupuncture. She is the founder and managing director of Many Lives Chinese Medicine here in the Bay Area. And we are so grateful because she is a Hot Pus Health medical advisor, and we call her for all things all the time. Therapy, mostly therapy and acupuncture, so that she, makes my chi, balanced and whatnot. Did I cover everything? Not everything, but that was...
Balance is key.
Well, I would say you are well qualified to have this conversation today, which I think many women want to learn about. I mean, honestly, I know I did almost whatever it was 15 years ago when we met, and how important it was for me going through, again, at that point, a fertility journey. And then, fast forward, we're on a perimenopausal journey together. But this notion that traditional Chinese medicine with, acupuncture has a place for certain women, right? And so I think where I'd love to start, if it's okay with you, is just level setting. What is traditional Chinese medicine, and kind of begin there. What is it?
So Chinese medicine is, it's one of the oldest medicines in the world. And it's such a big question because it encompasses, it's a very comprehensive medicine that has a diagnostic system, huge treatment opportunities. And under the umbrella of traditional Chinese medicine, there's, of course, acupuncture, herbal medicine, Chinese massage, Cui Na, Tai Chi, Qigong. It's just, there's just a lot of tools to choose from when you come to a Chinese medicine practitioner.
Yeah.
The way it works is based on the energy in the body. It's based on our chi. And if you when I nerd out, I go and look at all those videos, on the inside of the body and how you see the energy of the organs moving. Our hearts, obviously we have cardiac cells, so our hearts are beating for our hearts don't stop beating for 90 years. That's unbelievable. Our bodies are moving, they're dynamic. And the art of Chinese medicine is also dynamic. We talk a lot about balance and balancing out the system, balancing out the energy of the system. And while it is considered a little bit woo-woo, because it's hard for us to understand that we have an energetic system that does have a place in the, in the medical conversation. And so we access the chi or our energy
Mm-hmm.
through, we use meridians in the body. We use fine acupuncture needles to access different points on the meridians to actually shift and change the energy and where, how it's moving, and whether we're tonifying it, whether we're, you know, we're calming it. So we're always trying to bring the body back into balance. I'm not sure if that explains it very clearly, but there's just so much I could teach. I mean, I had 6 years of Chinese medical school just learning about qi.
Well, here's what I will say, and I thought it was, it's very interesting, and people who have never done it before, people who have done it, historically. When I was going through my fertility journey, I walked into this amazing, Stanford, UCSF, highly board certified OBGYN practice. And one of the OBGYNs turned to me and she said, Melissa, you're in your geriatric pregnancy, or so I was over 35. And I had an older husband and was like, this is going to be brutal. And she said, look, you need to call Beth Schiffman because we don't know what happens or what she does, but your chances of pregnancy just increase. And not just chances of pregnancy, but your decreased risk of, losing the baby and having a miscarriage. Ooh.
Oh, hi.
I don't even know how I did that.
Sorry.
So weird. I'm telling you.
It's
Chi.
energy.
My chi is totally in balance. Anyway, I guess to buttress what you just said, she didn't know. She basically was like, I don't know how this works. All I can tell you is that the patients that come in to see me who want to get pregnant and not miscarry, when I send them to a fertility acupuncturist specifically, it's unbelievable what happens. And so I guess to your point, it's just they don't know, but it works in many ways.
It's tricky for people to describe. Even us, people ask me, I go to gatherings, and I'm like, okay, don't tell anybody I'm an acupuncturist, because people want, they'll walk up and say, how does it work? And I don't mind explaining it, but it just takes a while to understand that our bodies have energy, and we can harness, we can work with that energy to create balance in our body to live the best life that we can live. And under that umbrella of traditional Chinese medicine, we have lifestyle changes, we have nutritional therapy, we have moxibustion that we use to heat up points, we have all sorts of tools to actually really thoroughly diagnose a patient as an N of one. Like every single person in my practice that I see for any sort of gynecological irregularity is their own universe.
Right.
I have a lot of gals that come in and who are starting to, they're perimenopausal. They're in their mid 40s.
Yep.
They're having irregular cycles. They're feeling hot. They walk in and like, I'm just so irritable all the time. And I'm like, okay, well, let's talk about that. So when we investigate how they're doing, there's a lot of talking, to figure out what their diagnosis is, because they're their diagnosis is going to be different than their best friends. And they say, oh, well, my best friend's doing this for their menopause, and their hot flashes, and I'm going to just do all that. I'm like, hold on, let's kind of reevaluate where you're at. And then lo and behold, they walk out with a whole different herbal formula and a whole different treatment. And so, the larger point is that we're all so different, and and Chinese medicine, as vast as it is, it really does have the capability to treat each individual exactly where they're at. Instead of, there's no broad spectrum anything in Chinese medicine.
Right.
I mean,
Well,
we use a lot,
I mean,
but it's, but
yeah.
for a root cause diagnosis, we have a constitutional diagnosis that we come up with, and then when you come in, we also treat what you're going through at the moment. So we have a root diagnosis and a branch diagnosis. I mean, I can teach a class on just right now on a diagnosis. So,
well, what I think is amazing is coming into your practice, for me, again, I mean, I joke that it's like therapy, but because the amount of time that you spend with each patient is a lot of time, right? And so
Mm-hmm.
first is kind of questions, unearthing what's going on, like how are you sleeping? How are you feeling? What are you eating? Have you noticed any changes? And then you take pulses, which I think is, I mean, I would love to hear kind of explain why that is important. You look at my tongue, you're like, let me see your tongue, which I'm like, really? Really? You're going to look at my tongue? But it's very individualized. And then you say, okay, I see what's going on. So can you explain that a little bit?
About what's going on with you or the
No,
pulses?
not me. I'm talking like what is the importance? I mean, I guess my point is to use every person comes in and uniquely in that moment you are treating that moment of their
We are.
symptoms.
Just as exactly as when you go in for blood work to do blood work, you know, those bloods are that moment that you take them. Yes, it's a big dartboard that we're trying to narrow down. It's the same thing with taking pulses and looking at tongues. When we take pulses, we take 9 pulses along the same radial artery. And, you know, I love treating medical people because they're like, what are you doing? And like it's along the same artery, but we're trained to feel different qualities of the pulses. Each we take 9 pulses, so there's 3 levels that we do and 3 positions. Each pulse corresponds to an organ system, so we can feel what organs are doing. I know, just
I'm here for it.
got to be a little sensitive to this. And then on our tongues, you know, and then I look at your tongue and I kind of make it look a little flowy and easy, but actually the whole time I'm treating, I am really in my Chinese brain diagnosing the whole time. I'm not only looking at tongues for the 6 Chinese principles, which is, I can go on about that, but we diagnose a tongue,
Yeah.
we diagnose by pulse. So we also diagnose by, we watch you walk in.
Mm-hmm.
We don't talk about this much to others, but we watch how you walk in.
Yeah.
We watch how your gait is. We can also feel your temperature. So after we talk to you and I put you on the table, I'll take your pulses, but I'm also feeling temperatures. We also use smell.
Mm-hmm.
Smell. We're taught smell. We're taught eye diagnosis. So there's a whole world of stuff going on diagnostically when you come in to see an acupuncturist.
Yeah.
And I love to share with my patients. I love to talk with my patients. I really like to know where my patients are at. So there's a lot of talking going on, but besides that talking, I'm over here going, okay, kidney yin, heart blood, liver
Yeah.
blood, spleen qi, you know, all my diet, I'm running through and ruling out at the same time.
Something you said that I want to talk about because, you know, you and I've had this conversation many times for like 15 years, is that I can come in and you can put anything in my body, but what I'm putting into my body nutritionally, the external stressors that I'm feeling on my body, you know, those are important and have impact. And so you could do all the work in the world, but if I'm eating poorly or if I'm having so much stress in my life, I'm not that I do, I have no stress in my life, um, that that impacts. And I would love to hear the perspective of how nutrition specifically plays into, because you're like, Melissa, you got to give this up, or Melissa, you really need to start integrating this based on some of the, you know, symptoms I've had.
Yeah. There's no doubt that our modern world is having a huge impact on our bodies. So
Yeah.
young women are going through menarche. They're starting their periods a lot earlier. We're going through menopause a little bit earlier. The I'm looking at because the I'm thinking about the amount of toxins that are involved in our world now. And you know, I'm not a conspiracy person at all. And in fact, you know, I'm like, people say, oh, that, you know, those microplastics are really getting in our brain. I'm like, oh, whatever. And then, and then I read,
Right.
you know, I'm looking about microplastics and how the toxins in our environment are definitely influencing our health.
Yeah.
And
Yeah.
So in order to manage the amount of stress that's happening in our valley and in our world,
Yeah.
and toxins, and also the crap food, the processed
Yeah.
food that we like, because we like to eat those cheese puffs and stuff because they make us feel really
Yes,
happy.
they do. Don't tell, but they do. It's
Don't
true.
go down the Trader Joe's aisle with that cheese puff thing because
They're
it's
so
horrible. Anyway,
good. Huh?
all those things, the crap food, the toxins, and the stress, all build up in our bodies, and our bodies are super sensitive and super smart. And what happens is we just get sick more often. Our systems are really imbalanced. So in order to combat those three things, we need a really strong immune system. Our immune system needs to be like wicked strong. And so to improve our immune system and our chances of health, Chinese medicine, functional medicine, functional nutrition, some Western nutrition as well. There's some great nutritionists out there
Yeah.
who help us realize that sugar really benefits nobody. No, there's not one person. We need sugar in the form of carbs for our brains to work. But in Chinese medicine, and as well as in Chinese medicine, we stay away from refined food because this medicine that I'm practicing was developed 2, 3, 4,000 years ago, where there wasn't Cheetos and
Right.
there wasn't Pop Tarts. I mean,
Right.
there was plums and there was fruits and there was all of the sweet things that they made at home organically. And so with the advent of refined sugar, refined flour, all these things we're really challenged. And so in Chinese medicine, we really do steer people toward, hey, let's replace the 5 Red Bulls you're drinking with maybe some bubbly water, or here's some tea. And yes, I can custom make herbal formula teas for you, but those are teas that are highly medicinal, and we're solving for a diagnosis. But on the everyday daily life, nutrition, it's important for yin and yang balance, which we talk about a lot, which I won't go into because it's a whole thing. The 5 elements that we
Right.
discuss, digestive health and spleen qi, and how I mean, if you're having diarrhea all day, I mean, not all day, but every day for 6 months, and you think that's normal, that's a problem.
Right.
Right. There's things that we talk about in session that does touch on, we definitely talk about food.
Yeah.
So the incorporation of nutrition into the Chinese medical healing model is very present, and we do use it a lot to gauge, where people, that's a very base, that's the first thing we start with is nutrition. And by the way, chewing. You got to chew your food. People don't chew their food. And people are, and people are surprised to hear me. They're like, oh, chewing, how boring. I'm like, yeah, it's boring, but you have to chew your food in order for the energies, in order for your body to assimilate it and to create energy from it.
Yeah.
I
heard some statistic, and this could be wrong, this was years ago, that something like 50% of meals in this country are eaten in a car.
Yeah.
So being present, you're trying to eat whatever you're shoving into your mouth while you're driving, commuting to soccer practice, you're throwing your kid a string cheese. Like you're not present with that. Or I will speak for myself. Oftentimes I struggle to be present with food because of, to your point, this constant movement and pressure that we've kind of evolved into.
Yeah.
So
yeah, and it's the modern life, and let's face it, a lot of the women, the moms that I treat, no, there is no time. Mm-hmm. And for me to add like more rituals to somebody's day is very overwhelming. And so there's a way to to bring to awareness what you're doing, and to help patients understand that, well, why don't we let's substitute this. And so it can go a little bit slowly, but the results are enormous.
Yeah.
When people really start to back off on their sugars and have maybe an extra 20 minutes of sleep, they come in and like, I'm a new person.
Well, can I just make a plug for women who are listening And what Beth just said, which is, it's so hard for her to add in another thing for us to do. And what I have found in my practice, which again, there are big gaps and there are times where I don't go, but number one, many HSAs cover acupuncture. Most do. So go in and check that health savings account or check your FSA and see if your coverage covers acupuncture. That's number one. So basically it's use it or lose it, go spend it. Number two is, even when I would go see Beth, it was an hour for me, right? So there was this notion of, I'm going in to see my acupuncturist, but I knew that I would be silent, present, and focused on just me for 1 hour. And that alone was probably just placebo effect of how it made me feel walking out. But I so rarely do something for self. And I feel like a lot of women rarely do anything for self. So even that hour of quiet is so precious. So I would just make a plug to go check your FSA and HSAs and book an appointment. And at hotpaushealth.com, we have loaded up as many acupuncturists and Chinese medicine practitioners as possible for that reason. So that's my plug for going.
And that hour of relaxation that's guaranteed and booked, it's not only that you are getting a deep parasympathetic nap. I can't tell you, I mean, I wake more people up during the day than you would imagine, but that deep parasympathetic rest is fantastic for the time you're there. But you also leave with a custom herbal formula that you can take at home, once a day, that will help replenish your vital energy, that will help balance out your sleep. It will help you be more rational, hopefully. But toward the menopausal, issues,
Yeah.
too, we have beautiful formulas that help with heat regulation. We're very big into temperature regulation in the Chinese medical world. And so while you might be doing bioidentical hormones, which is fantastic. Some
Right.
people really need them, and that's great. But acupuncture can treat right alongside of those bioidenticals for further balancing. And so I refer to bioidentical hormone therapy when needed. It can be very helpful, but to have that hour and then to leave with something in hand that you can actually be proactive in doing, and to have my my little conversation or my comic self in your ear saying, what, that sugar really isn't going to work for you, then you have a little bit of support on the nutritional end as well.
Yeah. I just want to punctuate what you just said, which is the yes and, where go see that OBGYN. You love your OBGYN. You're doing, menopause hormone therapy. Fantastic. You can also still do all of the above. You can go to your acupuncturist. You can go to a functional medicine provider. Like, it's a yes and I think that so many, oftentimes, particularly the zeitgeist of right now, which is like black or white. I'm pro hormones or I'm anti hormones. Mm-hmm. It's like you do everything.
Interesting.
The world is your oyster. Do what you got to do.
Yeah, it's true. I work, and you're right, Melissa. It's there's a huge partnership between Eastern and Western. It is not either or. I've always really loved working with my Western colleagues and my the OB guys and reproductive endocrinologists and my internal medicine doctors who we all work very well together. And there's a huge synergy and benefit in health when you get both sides.
Yeah. Okay, because you said something a little bit, and I want to make sure we talk about this, that Chinese medicine is thousands of years old. And if I'm not mistaken, that the Chinese were the first to actually have a gynecological practice. They that was table stakes, and they invented it thousands of years ago. But I would love for you to talk about second spring and menopause and the significance and the numbers and how that all works, because I think it's so brilliant.
So, so we've gone over the ways that how acupuncture can help menopause in all the ways. Hot flashes, reducing stress, improving sleep, relieving fatigue, all of the issues. We love treating menopause. There's an old and so in Chinese medicine, long, long ago, they came up with a system of the 7 years. So the Chinese believe that every 7 years, your body shifts into a different phase. So, for instance, zero. Okay, and first of all, let's just start that the 7 year
Yeah.
phase, you know, uh, transformations, all involve kidney energy. So the kidneys in Chinese medicine are not your Western
Hmm.
kidneys, but just a diagnostic tag for your essence, your qi, your jing. The kidneys are responsible for, um, in Western, endocrine system,
Right.
genetic material, the mitochondrial health. The kidneys house all of that. If you walk around San Francisco, you see people out rubbing in Chinatown. They're rubbing the backs, their back, low
Yes.
back. They're
Yeah.
energizing. There's an older generation, and they're energizing their
Yeah.
kidney energy. They want their kidney energy to work better, but they're associating that with their actual kidneys. But yes. So there's
Okay.
that.
I've seen it
Anyway,
now.
the,
No.
the hormonal shifting and the way that we transform ourselves every 7 years has the root conversation in the kidney energy or the jing. And so, when you're in vivro to 7 years old, it's you're a child, you're growing. Your kidney jing you're being formed by your kidney jing. It's your genetics, okay? And then every 7 years, there's a shift. And the second shift is 7 through 14 is when you start your cycle. Or when men also come into their hormonal uh, spring.
Yeah. Yeah.
So, the menarche, the starting of the cycle is very hard on young women. And I also treat a lot of young women who are going through starting their cycles, which is it's a very beautiful time. It's a phase in a woman's life, which should be celebrated, which we don't celebrate anymore. And then we have the 7 year cycles from 7 to 21 being, your reproductive system's maturing. And then 21 to 28, there's full expression. So it goes down the line until we hit 7 by 7, which is the 49th year. So 41 through 48 is the seventh of the seven, where menopause, you're premenopausal in that time, and you're starting to go through your you're starting
Yeah.
to have all these signs. So anyway, I'm sorry this is so wordy.
No, but it's
You're
not. But it's so good. Like, we get to 7 by 7 at 49, and what happens
what
to us?
happens is that our jing, our kidney jing, our kidney essence really declines, and we stop having our periods. Our periods stop flowing. So that's the time when the Chinese medicine sages talk about the second spring, and how in Western medicine, we see the second spring as, or we don't even talk about a second spring. What we see menopause as, what did you call it?
Well,
Dead
I was
wood.
like, I guess my point was, I think it's so wonderful and appropriate and beautiful that within traditional Chinese medicine, it's called second spring and not dark black winter.
Right.
Something horrible.
God.
It's like, no. This is a rebirth, right? The spring, as we all know, it's like new beginnings, new growth, new prosperity. You have this vitalization that happens that I feel like is often just totally overlooked in Western culture. And I think it's so beautiful to refer to it as the second spring.
Yeah, it is. Just like when we start our periods and when young men go through their hormonal process, old traditions used to celebrate those. Other cultures celebrate transitions. And then when women when we go through menopause, we see it. This culture is, but I was really sad about it myself, actually.
Yeah.
I had a grieving, and I was like, wow, this feels so weird that something I had for so long with me is just no longer. And then the second spring, and I love my medicine because it really had encouraged me to become more creative and more like, with the stopping of your cycle, the energy that was once directed outward to childbirth, to reproduction, taking care of others all the time, to producing it work, to being outward in the world, you stop your cycle, and then all of a sudden everything kind of gets directed inward. We're no longer menstruating, we're no longer having children, we're becoming, and now we can nourish our body's internal energy, and we have more mental clarity, and we have more creative and personal fulfillment. I mean, it's such a beautiful time, and it should be a time, and I think it's becoming more talked about too, where women are just becoming more powerful in their second season, their second spring.
Yeah. I think we hear that a lot, where, you know, you have the sandwich generation, you're taking care of kids and you're taking care of your older parents, and all of a sudden you're like, it's just me and I'm going to take care of me. And I think there's such a metaphor to that second spring of, you are not having to give birth anymore, which again, for many, many years today, still included, that, you know, the risks of pregnancy are real. And when that goes away, it's it's a tremendous gift for many women. And so I think that celebration is, I just think we leaning into that feels really, really lovely.
It feels just so much more hopeful and positive, and we do have so much more to offer the world, because we're not taking care of others. We're actually kind of coming back into our own. And also, and you know, how acupuncture and Chinese medicine looks at this is that, you know, we support it. That's why I have such a huge practice for menopausal and premenopausal women, because we talk about this in the treatment room. We talk about empowerment, and then we also treat, you know, everything that's going on with the patient. And so so patients walk out feeling really more empowered and creative and excited.
Yeah.
And know they don't have to leave their husbands, or, you know, all these huge, all these all these huge
example.
Yeah, they happen during this really edgy time of huge, you know, coming back into our bodies, going, oh my God, what have I been doing the last 15 years?
Yeah, I mean, I think that there's a misnomer that, you know, men have midlife crises, and it's like, no, no, no. Women are right there, and the volatility of hormones in in perimenopause, and then it waxes and wanes, and you see that chart of what happens, and you just totally nosedive, and then you're back up for air, right? Like, you come out.
Exactly.
And so I think that there is light at the end of the tunnel. When you speak, I'm deep in perimenopause, so I'm in the crazy part. But when I speak to women who are not postmenopausal, menopausal, because you're never post, you're just always going to be in menopause for the rest of your life. They're like, oh, it gets better. Don't you worry. I'm like, okay, I am the prize.
Yeah, really, it's a really rich time. And, you know, men too. Yes, men have their midlife crisis, but that is menopause. And both men and women are having hormonal shifts, and they all need to be acknowledged. I mean, it's great to have them acknowledged. You know, so the second spring is something that we really, really embrace, and we treat for it all the time, because we want that second phase of the life to be rich, and you want to be active and viable and clear and all of those things. So if you go into menopause with a crap diet and a lot of stress, guaranteed your menopause is not going to be easy.
Right. Well, you're amazing, and we're going to share everything about Beth and Many Lives Chinese medicine on, when we wrap this up. She's on our website because she's one of our most favorite humans on the face of the planet. And I think the takeaways for me anyway are, go take care of yourself. Take that 1 hour for you and book an appointment. Go check that HSA out, because it's use it or lose it, and go do something for yourself. And that this second spring really is beautiful, and that there are people who can support you through it, just with you, meaning that you are a unique individual, and that your symptoms, require, I would say, bespoke connection. And somebody like a Beth is going to say to you, here's what you need, which is going to be different than somebody else. And then last but not least, it's a yes and. So do whatever you're doing, but then, consider incorporating another purview and perspective. So we're so grateful for you, Beth. You're amazing.
Thank you for having me.
My God. This is one of so many. I can't wait. And I have to book my appointment. I'm going to do it. Okay.
Love
Heart you.
you.
Okay, love you. Bye.
Bye.